training opportunity with the State Employment Leadership Network. This training is we're offering this specifically to support coordinators. It's a membership that we participate in. It has excellent experts across the country who specifically focus on this and work with and support states who have developed this. So the training focuses on how to better support competitive integrated employment outcomes across our service system. And we have roughly 30 spots still available. And like I said, we're only opening it to support coordinators. It's a self-driven online training. It's about 5 to 6 hours. And then if you do participate, we'd love to get your feedback on this experience, because we're really looking at how to make sure we're supporting support coordinators as well in having the right resources, skills, and information to be able to support employment as well as the other interests that people have that you serve. So hopefully you'll find it useful. The training, I think the link was put in there. There are just 2 more days to sign up. So, but then you'll have a little bit of time to complete it because it's 5 to 6 hours online, self-paced. Also, you guys should be seeing or have seen a survey. We need your input on how caregiver compensation has impacted people on your caseload and their families. This is confidential. It's an anonymous survey, and it was developed based on input from families and support coordinators, and it'll take about 10 minutes to complete. Once we have this information, we'll use it to provide data to the legislature and to inform our decisions moving forward. And I know that families are interested in this data as well, as people are really interested in what caregiver compensation can look like in Utah. And families who are currently receiving in-home services through self-administered services are also going to be receiving a similar survey. So really thank you for your time and your input. And the link to that survey is also being put in the chat in case you haven't seen it. And then just a reminder about waiver services in school. Just remember that we can't provide waiver services in replace of instruction or something that the local education authorities are responsible and obligated to provide under IDEA. I know that we've had some requests and even some services that had been implemented that we've been working to resolve. So just please remember, we have to be sensitive to what's required under IDEA in the education system. Then COVID critical incident report. So the Office of Long-Term Services and Supports have changed their COVID reporting processes effective July 1st. The only COVID cases to receive incident reports and investigation are COVID cases that result in a hospitalization or death. So now all other COVID cases no longer need to be reported as a critical incident. If you have questions, you can send those to Audra Solovi, and we'll put her email in the chat as well so that you have that. We also wanted to make you guys aware of just work that we're doing on a rape prevention grant related to people with disabilities. We've been partnering with in the Department of Health and Human Services, the Population Health, on their rape prevention and education grant. And part of this process, DSPD staff have been monitoring and responding to individual cases of sexual assault. The purpose of this procedure is to ensure that any additional services in the community are being pursued and advocated for. We know that there is definite underrepresentation for people with disabilities, and access can be difficult. So this may include access to victim services, individual counseling, or additional supports to ensure future health and safety needs are met. This outreach is meant to provide advocacy and support to individuals and services, in addition to support coordinators who may be struggling navigating the system yourselves. Please feel free to reach out to Bob Pease or Brenda Carlisle if you need assistance in this area, and they may be reaching out to you as we become informed of cases either through APS referrals or incident reporting. We really appreciate your cooperation and your support in this as we all work together to really improve quality of life and services for people we serve. We also wanted to let you know that there is a new fiscal agent contracted with us. As you know, Leonard Consulting is no longer contracting with DSPD as a fiscal agent. So adding new Premier as a fiscal agent at least gets us back up to 4 fiscal agent options, just so you know that that option is out there. And then I wanted to also talk about the hearing process. So just thanks to all support coordinators and families who have been participating in the hearing process. We really appreciate your patience and understanding as we're navigating some of the ongoing changes and challenges. We acknowledge that there are some frustrations with the timeframes involved from the beginning to end and share some of those frustrations. In order to help alleviate the backlog and to promote more timely responses, we currently are hiring a full-time staff dedicated to DSPD hearings. The volume of hearings, as we've been responding to steps in our audits, in our OLAG audit, has increased the number of NOAs as well as hearings. So this is to try and be responsive to that changing need. In the meantime, there are some things that you can do to help. So please make sure that your client's contact information is updated in USteps. This includes mailing addresses and identifying information for any guardian and uploading guardianship documents. We also appreciate it if families can include their emails addresses on the hearing request forms to help expedite scheduling hearings. We hope to update the form soon to make it more user-friendly. Also, help your clients and their families understand their hearing options. Some families are coming to a division resolution meeting and not really knowing why they're there. So remember that the person or their guardian should be the one choosing to appeal the decision that is made about them and their services. Any questions, concerns, or updates should be sent to dspdhearings@utah.gov. Please don't email them to Waiver Manager@utah.gov or Yamil, because this just results in multiple emails going to different addresses, and it just creates it adds to the backlog as they try to work through what's a repeat and what isn't. We understand that some situations require quick follow-up, but the multiple emails kind of compound. It just makes it a little bit harder to process everything. And I will say, just as you're looking at and thinking about the follow-up, the point of the appeal process is to preserve a person's services. So if they do that appeal, that's preserving their services in place while they're going through the process. I think that if they do that appeal within that first 10 days, so it is really important to make sure people are doing that when they have a concern. Next, I wanted to go over some staff changes. I think, so as you know, Amy Huppy left and Brent Peterson has accepted the position of the Employment Planning and Inclusion Administrator. Lisa Wade has replaced Bryn's old position over our Employment and Inclusion and Planning team. Pam Madsen is returning to DSPD as part of the RFS committee, and she started, I think, just at the beginning of this week, just barely. It might have been last week. So we're really excited she's back too. Luann Jones and Brittany Quintana have joined the intake and waiting list team. We have Janet Hellickson, who is on the community transitions waiver to do as a caseworker. Mia Risa is a caseworker specialist on our team that transitions people from the waiting list. And Amanda Barr is our program and administrator for the transitions and assessments team. I mean, I think several of those names are probably familiar to all of you. We're really grateful. I feel so lucky that we have like parents with so much great experience and knowledge coming, as well as staff and our new hires, right? Just good experience, whether it's in the education system before they came. So we're really excited for everyone who is here, and I hope you guys all are too. So our legislative updates are pretty, right, things that you're probably already have been hearing about. So we've had a rate increase that went into effect for all DSPD providers and support coordinators on July 1st. So for the last year and a half, our home and community-based services providers and contractors have received supplemental payments funded by the American Rescue Plan Act. In this past session, the Utah legislature appropriated ongoing funding to roll these supplemental payments into a permanent rate increase. So the ARPA funds will help fund this rate increase from July 1st, 2022 through March of 2024. And then after that, the legislative appropriation will fund the ongoing rate increase. So if you followed during the session, the money was appropriated intentionally with a full reduction that, like, for this first year, because it was acknowledging that this is actually ARPA funding, but then but they needed a way to have it go into place after that ARPA funding was like ended. So, and just also a reminder, this is support coordinators don't, right, didn't have that 19.5% that providers have. So there's probably not as much clarification that needs to happen, but the ARPA funds specifically must be used to expand, enhance, and improve home and community-based services. And they can be used more broadly than just direct care wages for the direct support professionals. The 19.5%, I think you guys are familiar with the fact that in our provider system, when that was appropriated by the legislature, it was dictated that that could only go directly to rate increase, to direct support professional wage increases. So the ARPA funds have a little more flexibility than that, but they do still have a requirement around them. And that will be reflected in the contract. So if you guys recall, you had to sign an attestation that you would use ARPA funds for that purpose. And since this is going to be rolled into the rate, that language is now going to be into the contract to demonstrate. So we're able to demonstrate to CMS that we are utilizing funding appropriately for how it was allocated to us. Waiting list services. I think, Jamie Douglas, are you on? I can't remember if you were here. Okay, I thought you might have a conflict, so I'll just go ahead and talk about waiting list services. So soon we'll have limited services available for some people on our waiting list. These are made available through ARPA funding as well. And this is funding that was specific to home and community-based services. So it has to remain within home and community-based services. We're still waiting for one final approval to start using this funding, and we'll be able to offer, it looks like, $10,000 to at least just over 1,100 people over the next 3 years. And we'll be hiring temporary staff to help with this project because that's really quite a large number of people, even spread over 3 years. The waiting list team has updated eligibility on cases and the transitions and limited. So on people who are transitioning permanently into services, Like we have the waiting list team already updating eligibility to make sure people are ready to move. As you recall, we're doing this across the year rather than all at the by July 1st. And then the transitions and limited supports waiver teams are busy opening new cases. So we'll go ahead. I'm going to go ahead and give some time to Amanda Barr so she can talk about UCANS updates.
All right, thank you. All right, so the UCANS, we've been doing them for a little over a year now. We started in May or June of last year. So a lot of the cases that were completed, a lot of the UCANS that were completed last year will need updates. You'll probably get a reminder either through email or on USIP saying, hey, the UCANS needs to be done. If you can take a look and see if the assessment's already been completed, then that means that you, as long as you're certified, need to update it yourself, and you don't need to schedule with one of the assessors on my team. So if it is an initial UCANS, then you can go ahead and schedule it with with the assigned member on my team, and you should be getting an email regarding that. But just make sure you take a look, because we're still working out some of the kinks on sending out emails and determining which one's new and which one's just an update. The UCANS, they need to be completed within 90 days of the PCSP at a bare minimum. You can add dates and add date and notes with any new information. So if you have any new information, any changes, it needs a bare minimum of 90 days, but you can update it if there's a major change, if the client moves from residential services and back to an in-home setting or vice versa. Any major changes in the client's life should be updated on the UCAN so it's as accurate as possible. You don't have to wait for the PCSP. We're still looking at getting some direction as to if the UCANS hasn't been done. There's an algorithm that they're using to pull all the UCANs so we can get everyone's UCANs done. We're doing as many as we can, but there are some people that still haven't received the initial UCANs. And for right now, we're just waiting until that name gets pulled and assigned to an assessor. All right, next slide, please. All right, for the UCAN certifications, you have to recertify annually. So if you did it June, July of last year, you need to make sure you go back in to the PRAID website and go ahead and recertify by getting a 70% or higher on the 21 plus adult test. If you doing your initial certification, you need to send the 013 form to either myself or to Tiffany Alexander so we can verify everything. If there's no gaps in your certification, you don't need to keep sending the 013 form every year. It's just that initial, or if there's any gaps in your certification. So if you were a month late, 2 months late, if you took a leave of absence for a few months and missed your opportunity to recertify, then you need to send that to us. But if you're consistent and you're remaining certified, you don't need to keep sending that, or you don't need to send that annually. Next. All right. One of the issues, or one of the reasons we want to update is the PCSPs. Make sure they're accurate. At least the basic and the core information is accurate. We have had some UCANs that we read through the PCSPs. We look at the age. We look at the information, and we'll mention a comment about a parent, a grandparent that plays a huge role in that person's life, as according to the PCSP, only to come to find out that person passed away 3 to 4 years ago. We really want to be able to prevent any trauma to the client. We don't want to bring up any old wounds. If the client's doing really well, we don't want to revisit any old wounds or trauma. So if you can please just make sure that information is updated, so we don't have to open or express that, because that's not a fun situation for anyone. And we want the UCANS to be a very positive experience. So if you can just make sure that information is updated. And next, all right. Any sensitive information, if there's any past traumas, any behaviors that the client may, that talking about it may trigger the client, if you can send either an email to the assessor or write in when you schedule your appointment using DaySmart, if you can write a note saying there is some sensitive information not to bring up, and we can work around that, either excusing the client early or having the client come a little bit later. We don't want to re-traumatize anyone, and that's a good way to make sure that we know that there is some triggering information out there, and so we know to avoid that during the main UCANS assessment. I've personally received several emails from support coordinators who do this exact thing, saying, hey, can we, give us a few minutes at the end, we could talk about it, excuse the client, and it worked out really well. So we didn't have to cause any trauma or cause any behaviors for the client, for the staff to have to work with and manage.
Thanks, Amanda.
Great,
We'll
thank you.
We'll go ahead and have Tamara give our employment updates, and then following Tamara, we'll have Kristen do some training regarding finance. So we'll go to there.
Okay. Thanks, Angie. So we have received some questions about whether a person in DSPD services who is hired as staff for another service provider can receive job coaching or coworker supports while on the job. We are excited about the possibilities and creativity. So here are a few points we want to clarify about these situations. Next slide, please. Consideration for these positions should always include determining whether the person can complete the essential functions of the position without paid supports. Supportive employment individual, SEI, on the job would not be recommended for these positions. Some SEI could be requested outside of the scheduled shift to work on skill building activities. Supportive employment coworker, SEC, is also not recommended. SEC supports would provide additional funding to a service provider already receiving reimbursement for each person they provide service to in that setting. Some personal assistance services from a separate service provider might be appropriate for person-centered activities of daily living needs on the job when the employer is able to support the employee. Vocational rehabilitation, VR, is the first place to seek job coaching supports. If you have not started a new VR case for this position, we recommend starting there. They will also review the position and determine if the position is competitive and integrated. On an individual basis, we might consider some time-limited and minimal job coaching to learn what is needed to meet the requirements of the position. Ongoing supports for these situations should come from the service provider employing the person. If you have further questions, feel free to send them directly to the Employment and Community Inclusion Team email address, and that email address will be posted in the chat.
Hi, everyone. Just a few things to go over from the finance team. We have, first off, budget utilization reviews. So we've completed all of the budget utilization reviews for FY22, and a big thank you to all of you for your help getting those completed this year. I know it was a pretty big task, and so we appreciate your help on that. And we're getting started on the new FY23 reviews, and we're going to make some changes, some adjustments to try and make the process go more smooth this year. The first change is that the USTEPS team is going to pull the lists on a monthly basis instead of an annual basis. And it will be based on when the individual's plan cycle ends. So they will be identifying any individual budget who in the last 2 plan cycles show a $3,000 or more surplus. So for example, on September 1st, that's the first one we'll do this year, a list will be pulled that shows individuals whose plan cycle ends July 31st, that in the last 2 consecutive plan cycles had a $3,000 or more budget surplus. So if an individual on your caseload has been identified as having a budget surplus, a log note will be generated to alert you. You'll also have the ability to run a report to see anyone on your caseload who is part of the budget utilization reviews for that month. So hopefully by making just this one change, it will allow your team to review the budget during your annual planning process and make the adjustments as necessary before it is even reviewed or come to the RFS committee. For the month of September, the justification process will continue as before, with the support coordinators submitting their justification through the Google Forms, the RFS review, the pro forma budget cuts, and the NOA process will continue as they did with the yearly review. If a justification is not returned within 10 days, the pro forma budget will be automatically reduced and the NOA sent to the individual. But the second phase is targeted to be ready in October. So in this phase, many of the processes of the budget reviews will be moved to U-Steps. There'll be screens in U-Steps where support coordinators will be able to review which individual budgets have been identified. They can submit their justification right there, and the RFS committee members will track their reviews and determinations all in that same area. We're also working towards a way for support coordinators to be able to track the NOAs and appeal processes in U-Steps that go along with the budget utilization reviews. Hopefully next time when we meet, next quarterly meeting, we'll have those screens ready in detail and can review them with everyone during that time. We've had some confusions and questions directed towards us about the adjustments made in the pro forma budgets. So just as a reminder to everyone, the pro forma budget cuts are just a way for U-Steps to recognize when an NOA needs to be sent out. The actual budget cut does not occur until the support coordinator makes the change to the plan budget. So after the NOA has been sent out indicating that the budget is recommended to be cut, the individual has 30 days to appeal the decision. If the individual returns the NOA within 10 days, the budget adjustment is removed from the pro forma budget as the appeal process is completed. If it's returned within that 10 to 30 days, the pro forma budget cut remains as the appeal is processed. And then after 30 days, the appeal window is closed. So we ask that support coordinators wait at least 30 days after that NOA has been sent out before making any changes to the budget. That allows time for individuals to appeal as needed. And again, a big thank you for your help with that as we work through that system. We've also had some questions regarding records and record keeping requirements. And so please refer to your contract for a complete description. But as a reminder, all contractors are required to retain adult client records for at least 6 years from the day of last day of service. Records related to clients under 18 years old should be retained for at least 6 years from the date of the last service or until the child reaches the age of 22, whichever period is longest. Administrative records should be retained for at least 6 years after the Department of Health and Human Services makes the last payment on the contract. And all records related to any audits initiated by federal or state auditors or to any pending litigation should be kept until 6 years after all audits are completed or litigation is resolved, including any related appeals or time for the appeal has expired, or for 6 years from the day your contract terminates, whichever is longer. Also outlined in the contract are directions on what to do with records if you cease to provide services, methods for destruction of client records, client record confidentiality requirements, and what to do in case of loss or disclosure of clients' records. So there's a whole lot of information in there. Again, refer to your contract for specific details. There's also additional information in the SCE contract about the scanning and submitting into U-Step requirements of what you can do to make the electronic documents. There's also information about that in the image document sections of the U-Step help manual, so you can refer to that too. Just make sure if you're going to be scanning documents that they're clear, legible, and complete. And it's important that they're categorized correctly and associated with the correct person. Once you've verified that documents have been successfully loaded into USteps, the hard copy of the document can then be destroyed or protected through either encryption or a locked cabinet. So again, refer to the contract UStep manual for more details on how to properly manage the original versions of the documents. And the records, regardless of the format, if you have the hard copy, if you have the electronic copy, if it's been uploaded, it needs to be kept according to the contract lengths, either as a hard copy or as uploaded to the UStep systems. And finally, behind questions, the FY23 budget worksheets and the master worksheets will be uploaded to the DSPD website either today or tomorrow. They should be available. There you can locate them under the provider tab under forms. And it looks like there's a bunch of questions about some of the utilization reviews. I'll go ahead and put those in our Q&A section and answer those as they come up. And that's all from our section.
Thank you, Kristen. And I think Katie is helping get those over. We are at our Q&A now. I'm going to start, I know we've got a lot of questions during this and we're going to try to get through all of them. And honestly, looking at the time, hopefully we will. We have some questions that already came in, so we'll start with those and then just keep working through the questions. So one that came in before our meeting was, can SSM, so the massage therapy services, be billed in correlation with RHS services? The simple answer is yes, they can. The full answer is also use your best judgment. The state implementation plan is silent on this, and as with all services, you have to consider the person's needs, services that should be utilized, and would they need assistance with ADLs potentially while staff are there, or could staff that are in the home, would they be focusing on some other roommates at that time? Similar to having ABA services provided during another service. And just to let you know what the waiver states, it says the amount, frequency, and duration provided will be reflective of the prescription completed by a medical professional for medical benefit to the person. This service is only available after all other funding sources have been exhausted. So that's what the state implementation plan, the waiver, speaks to. The next question is a monthly summary or quarterly summary required for self-administered services? The answer to that is quarterly. When you go through your reviews, so when the review team comes out, they'll be looking to see that you reviewed and provided an assessment of quarterly summaries. So they'll be looking for that in your log notes. If you need more information about that, you can refer to the Self-Administered Services Manual, which is online. Our next question is, there are very limited RHS accessible group homes. Is that something the housing specialist can work on with providers? We have been sending out ISOs for accessible group homes with very limited options. So our housing coordinator, Camille Bowen, has been working on this issue really for many years. She reaches out, works with housing authorities. She'll work with our providers as well. And because this is a housing specific question and we have that quarterly housing meeting, this is going to be included in that for those discussions and kind of information. So you'll be able to hear directly from Camille or Mandy, and they'll be kind of talking through this and how to tackle some of this. So thank you for bringing that up. We know housing can be a barrier to accessing needed supports. So we look forward to continuing to work on it. Our next question is about UCANS workers, and Amanda Barr already spoke to this a little bit. It just says, can you remind them to review the files beforehand and discuss sensitive information that is in the file without the client around? And just so you know, we've shared this with our UCANS team, that feedback and the concerns that were expressed. And when you have a specific concern, it really is easiest if you can let us know like who the worker is, who the client is, and when it happened. Because we can address this and generally, but also if we know that, we're able to follow up directly with someone to help improve our services. So thank you for bringing it up. Our next question is, we are still seeking issues with no staff and RHS placements on visits. Have you been hearing improvement of staffing from providers? An example is a support coordinator went into a group home where there were 3 individuals and no staff. So for us, our anecdotal reports from providers are that the situation is greatly improving. We won't have data on staffing, so like as the final billings are processed, we'll be getting reports from providers. So one of the things required legislatively is that we're demonstrating that all of that funding went to direct care wages, and how part of how we track that is change in wages as well as like turnover and vacancies. So we'll have better data on that when we get our first report. But anecdotally, the report is that they are improving, and we've definitely heard and seen examples of people being able to move back into their own spaces where maybe they had been consolidated together before, as well as engaging in activities that are meaningful to them that they had not been able to engage in. So another thing I would say on this is that please report these concerns to our program administrator. I would give them to Marcy Platt. And then also, please let us know who the provider is and the setting. We really cannot follow up on these without that information. And also, if you believe fraudulent billing or services are occurring, you need to report that as well. Like the Medicaid Fraud Control Unit would be a place to report that, or the Utah Office of Inspector General. So please make sure that you're sharing that information so that we can resolve it and address it. Our experience from our staff, our staff have been helping people move out of intermediate care facilities through our settlement, and we're experiencing an easier time finding placements for people. So it's good to know though of these concerns so that we can follow up. So caregiver compensation. If this continues, are there going to be some set restrictions in place? There have been some issues concerning to support coordinators, such as parents getting mad if they send you a timesheet on the 15th and the support coordinator is out of town to sign it that day, or out doing visits and unable to sign the day that they come in. The deadlines are within a couple of days of the 15th and the end of the month. And the other example was, as support coordinators, we are signing the timesheets, but we can't verify the hours as we don't have access to other timesheets to assure double billing. I'm assuming double billing isn't happening, and it isn't in our contract. So caregiver compensation was developed and implemented under Appendix K to quickly respond to urgent needs due to the public health emergency. That is still the only authority we have. So the accommodations we made under Appendix K are how we are still implementing it. We do expect adjustments if this is made to be an ongoing service. For example, right now, a parent can be both the employer and employee, right? That is not, which is why we need a different mechanism. Currently, the survey that's out for support coordinators and families regarding caregiver compensation is something that we'll be using to inform us. So please take the time to complete this survey. Okay, our next question is, we have been told that MTP has been added into the contract for DSI services. The RFS committee has deferred questions or requests saying that MTP can only be used with DSI if the person is at the center in a DSG program, not if they are DSI in the community with staff. Can we get clarification on that? So I'm just going to read to you what the contract says under DSI to help inform you of that. So it says provide transportation of the person during the DSI program, right? So that's included. Transportation during the DSI program is part of the service. The contractor may bill DSPD for MTP for transportation of the person by the contractor to or from the DSI program. So I do think there is some latitude in there where it can be hard to distinguish if it is related to just transportation occurring from the program versus to and from a DSI program. The contractor, it also says the contractor shall provide staff during transportation as needed to ensure the person's health and safety. And I just want to add, as we receive and respond to our audits, so we had our OLAG audit, we're anticipating the Utah Office of Inspector General audit, and we have some internal audits happening. So as we receive and respond to these, it's possible that part of the response would be evaluating service descriptions and parameters. That may be part of what we have to address, so just please know that whatever you have today, as we respond to things, it could look a little different in the future. We have a question on RFS concern. It says, as support coordinators, we submit them in a timely manner based on the need of the client. Oftentimes they sit for up to 3 to 4 weeks before being reviewed. Once they are reviewed, we are getting emails and phone calls such as, we need this within 24 hours, or please get this form to me by today. So I really just want to say thanks for your feedback. When you experience this, can you please share that information with Kristen Cornea? It's really difficult for us to follow up or evaluate our system without this, especially because when we look at the data, 3 to 4 weeks is not the norm. It's much less than that. It's like less than a week. So it's going to be really helpful for us to have something tangible to help us understand this better. So we'd really appreciate that. A question is, many support coordinators are not being paid accurately for ARPA funding. When ARPA was contacted, they were told there was nothing that could be done. What is being done to ensure that all future ARPA payments will be made accurately? Also, will ARPA payments continue, or will they be added to the rate? So I think, as was recently announced, the ARPA payments will be changing from the quarterly supplemental payments to a rate increase. And this change is occurring to ensure that all future ARPA payments are more predictable for our contractors. Concerning the inaccurate payments, first, please note that the quarterly ARPA payments are based on the Medicaid adjudication date, not the service delivery date. So SCE payments that were submitted and processed in caps for each quarter are sent to Medicaid if they're Medicaid eligible. And if the payment meets validations, the payment should have been sent to the DSPD caps for the ARPA processing. So if you have any situations that meet this description and weren't reimbursed, please send the details. Like Kristen and Mel and Bob's team, they've all been willing to look at these. It does seem to really come down to the Medicaid adjudication date being the deciding factor. We had a question come in that we're going to have to take a little more time. It came into our DSPD info email. We just received it, so it's going to take us a little bit of time to get an answer for you. The question was about families being able to post job openings when they use SAS on the DWS job postings. So a support coordinator and families they're supporting have been running into some barriers there. So we'll go ahead and do some follow-up to figure this out too and get back to you. I'm sorry that we weren't able to get something in time for today. So there was a question on if we're going to be notifying providers about the new incident reporting for COVID. Nothing has been planned yet, but that is a really good idea to make sure that all providers are aware of that. And we're going to have to make sure this aligns with all of the licensing requirements that they'll be checking with providers so that they're tracking everything required under licensing as well. So we can work with our comms and licensing to make sure we get that information shared. So thanks for asking. And then will the DSPD org chart and employees listing be updated to reflect these changes? I'm sure that's referring to the changes I read during this meeting. Yes, we'll get this updated and on our website. That's a regular question from our staff too. And we do want people to know like who's where and who they can contact. So question, Angie, can you address how DSPD will be working to expand direct care supports to serve those taken off the wait list, as finding providers is very difficult? So one of the main ways that our system was tackling this was having such a significant rate increase for providers so that we can attract and retain direct care staff. We've also looked at like what are the needs of direct care staff, like how we can address this. And as I've spoken with Matt Wappett, like we know that's something that they're working on too. And we really don't want to be like duplicating work. And we know that they've reached out to others to kind of get questions and feedback on what should they be asking or looking at. So we know that they're putting together and having focused groups with direct support professionals. So we can also be tackling that. We have our limited supports waiver, which is 10% of the people who are coming into services. Self-administered services are another avenue that people utilize. And we do regularly have new providers start. And I know that there can be a learning curve depending on what their experience is. And whether they respond or not to RFSs, ISOs, that people don't always respond, but we just continue to look at like what services are available in our system. How do we strengthen that so that services are available both rural, like wherever you're living. So I don't have a different answer than I had before around like just provider capacity if someone's not providing direct care staff. And I also, like one of the things that we're planning to do, if you recall the survey that we did in January prior to the session, that had questions specifically around like how long does it take to get services. We plan to continue and do that survey on a regular basis so that we have a better understanding of the health of our system and how that is going. And if you are having troubles like finding placements for someone you're serving, please reach out to us. We call providers regularly. We have staff who are doing the same thing as people are coming into services through the settlement and also through like when we have emergency services. So we're happy to like partner and try to find solutions on that. So a next question is, hold on, I just bumped something. Could we have some time to review how the ARPA funds and service descriptions are going to be added to our contract before it is completed? So the rate, that email already went out to everyone about how the rate is going to look when it goes into the contract. And like the service, I'm not sure what the question is referring to on service descriptions. The ARPA funds have requirements with them that we're using them to like enhance HCBS. So there's not a lot of flexibility for us with that funding. It's specific about how they need to be used, and we need to be able to have the right records so that when our system is audited to that, we have that in there. And that you all are able to keep your records. So when someone comes to look at your services and records, you have that available as well. I don't know, Joseph, if you have anything you would add or clarify or change there?
Hi, Angie. No, nothing to add.
Okay, thanks. Okay. Kristen, I think this next slew of questions are probably for you. So will the budget be pulled for every client every month or right before or after the Pcsp meeting?
Okay, so clients' budgets are going to be pulled based on the end of the individual's plan cycle. So the list is going to be generated with the lag time of a month so that we can get all the billing submitted. And that's just to allow us to review 2 complete plan cycles for each person. But each client will only be reviewed once each year. It's not going to be every month that we review every client. It's just once a month when their plan cycle ends. Once a year when their plan cycle ends.
Thanks, Kristen. Just stay online. Can we get an email for utilization reviews that are required and not just a log note?
Yeah, and that's a great suggestion. It's something we've talked about and we're looking into. It's something we need to work with the USteps team to be able to generate that.
And then where can support coordinators seek a copy of the NOA for utilization cuts when the family does not receive the mailed form?
Yeah, so currently you have to email me, and my email is kristencornia@utah.gov. Currently, when they're generated from that UStep system, they come into a PDF form that just comes to Chad and I. And so you do have to email me. I'm happy to send you a copy of it. That is one of the things we're working on in the second phase to try and make sure that those are a part of USteps and you can just pull them immediately once they're generated.
Thank you. And then we have, you said an NOA is started after we change the budget, but if we wait 30 days to submit the NOA, that does not make sense.
Yeah, and this part is confusing, and maybe it would be good for us to put a worksheet together or something to send out. So, but the NOA is generated and sent after the budget adjustment is made in the pro forma budget. So just remember that change in the budget pro forma simply just alerts the system that an NOA needs to be sent. Once the NOA is sent, that starts that 30-day window for appeal. And it's only after those 30 days have passed that the support coordinator should change the budget. And that is the actual budget change as the result of the NOA.
Thank you. Okay, so the next question is, why is it even necessary for support coordinators to approve SL3 timesheets? I think I alluded to this a little bit initially earlier to one of the questions, and Joseph, if you could be ready to jump in and help clarify anything I say, that would be great. So when we were responding to the public health emergency, and I know it's been like 2.5 years now, but the Appendix K is still what made it possible for us to offer caregiver compensation in our state. And it's still the authority that we're working under. I know it's like significantly longer than we anticipated. So as we were looking at how to quickly implement this, as people were not having access to services and or had really high compromising risks and we're concerned about going into group settings. One of the solutions was to allow a parent to be the caregiver. And in some cases, that meant that the parent who was the SAS employer would end up also receiving caregiver compensation. And to help mitigate some of that conflict, that is why support coordinators need to review and approve timesheets. And it truly was not a plan to have that be, right? We did not anticipate 2.5 years later to still be under a public health emergency and under our Appendix K, but we are evaluating like what could caregiver compensation look like in our system. I know parents are very interested in it, and I know that it is not all parents, right? Some parents don't want that. They want to make sure that they have other services because they need that respite. But there are parents who are very interested because they've seen such a positive change for their family member. And I know they're doing advocacy. And so that's part of what we're doing with these surveys is we want to make sure we understand the needs in our system. And we're also like talking to other states about how they manage this. Some states are just like us. They implemented it in response to the public health emergency and are kind of navigating this as well. But there are some who had implemented it earlier. And so we're definitely looking to learn from them about how things can look if it were to be an ongoing service in our system. I don't know, Joseph, what else you have to add to that?
Yeah, the only thing that I'd add is we were concerned initially too about parents being both the employer and employee at the same time as they were navigating SAS. So that was, and Angie's correct. I don't think any of us thought we'd still be here 2.5 years later. And this is an issue that we are addressing in future policy development as well.
Okay, so our next is, I have submitted a couple of RFS requests lately and have been informed by the RFS committee members that the maximum amount of SAS services is based around a total of 40 hours per week. Is this a new metric that support coordinators should expect to be the norm? So Kristen, it looks like you are ready for that.
Sure. So yeah, there are certain SAS services like we've mentioned, caregiver compensation that is limited to 40 hours a week. But other than caregiver comp, the SAS services are really reviewed as a whole to just best meet the documented needs of the individual. There is an overall dollar limit to SAS services, and if an individual needs a higher amount than that, we do need to get director approval. We have a system set up to do that. But overall, it's really just looking at what the documented needs of the individual is in review with all the other services they're receiving.
Thanks, Kristen. We have a question that says, is there a plan to move limited supports waiver services to support external support coordinators in the future? It's potential in the future. At this time, it's staying with DSPD we haven't even had the waiver for a year, and we know that we have some things we need to learn about, like what it takes to do support coordination on this waiver. So I think it's a good question, but at this time it'll be with DSPD, and it's set up as an administrative cost, right? As an administrative service at a different match because of that. One question is, finding behavior supports is really challenging also. Any suggestions? I don't have like a magical answer for that either. Like for us, it's very much just continually reaching out. Like doing an ISO, if you're having challenges with someone specific, please reach out to like our teams, and we'll work to help find someone too. It is like specialized services. It can be hard to find that. So we have a question on, does DSPD offer new service providers training on contract requirements? I have found a lot of the new providers do not understand the requirements, and I end up training them on documentation requirements, etc. I don't know if Carrie Bambro is on, but the Office of Services Review, who does the contract review with providers, they do meet with new contractors and do an orientation with them, and they like regularly evaluate that, so that they can update it to make sure. It would be really great to get feedback on like what are some of the things you're having to train them on, so that can be incorporated.
Angie, Carrie's not on, but I am, and I can clarify.
Hello, Jessica Hooper. For
Hi.
anyone who's like not online and on the phone, so they know who's talking.
So our Office of Service Review does a pre-solicitation process with new providers doing the 90743 services. So they have to go through like a policy, human rights plan, like all and settings rule, interview trainings with us. We verify all of their policies and procedures are compliant with contract and settings rule prior to them even being allowed to be granted a contract. And that process started officially in the procurement process in November of 2022. So if you are having problems with newer providers that are new this year, please reach out to our office so that we can follow up, because we do screen all of them prior to their contract being awarded now. So I hope that helps clarify.
So Jessica, a question that came in while you were talking is like who to reach out to or how to reach out to the Office of Services Review. Are you still using the OQD email? I'll let you give them.
Yes,
that.
For now, we're still using the OQD provider quality email, and I'll pop that in the chat for everybody. So you can reach out to the OQD provider quality at utah.gov, or you can reach out to myself or Carrie.
And would that be the best place for them to send like the training that they're having to provide for new contractors?
Yes, ma'am. That would be the best place to send to us.
Thanks so much. So the next question is, we are also finding that new clients coming off the waiting list are not having any assessments done prior to being transferred to us. When that happens, can you please let us know, because we're actually tracking, making sure we're getting the UCANS done before we're transferring them. So if something, and I mean, we've hired additional staff that are temporary staff to help make sure we're able to get this work done. So please, if you could just email Tyler Black or Amanda Barr directly about when those are not done, that would be helpful for us, so we can make sure our processes are catching what we need and we're making sure that we're getting our assessments done. So thank you. Okay, Kristen, this looks like a question for you because it starts with your name. Kristen, thanks for the clarification on the timing of the utilization review. You mentioned that we can discuss utilization changes at the person-centered support planning meeting. However, the planning meeting happens in the last month of the plan year. So the utilization year won't have happened yet. In fact, billings don't clear for a month or two of the plan year ending, depending on how fast the individual provider processes billings. Could you please clarify further when you see an individual and when you see an individual's review happening?
Sure, yeah. So what we're hoping is going to happen is that the teams can be proactive in reviewing the budgets. So they can look through what's been used in the last 2 years. And if there is a recognition that services are no longer needed or that they're not being used, the team can make the decision at that time to change the budget on their own. It's also a great opportunity to review absentee rates for residential services and make those changes. We found that that was causing a lot of underutilization, is incorrect absentee rates that can only be changed at the first of the year. So we're hoping that you review these, make these changes, and then communicate that information to us. That's why we have the justification form. That's why we have that Google form that you're going to fill out. Let us know what the team has thought about, what they've already implemented, what they've already changed, so that when we do our review, we can take that information into account.
Thank you. So we have a question, Kristen, that says, you may have answered this already. If so, sorry, but can you please let us know when fiscal year 2, I'm thinking 23 probably, worksheets and, okay, know when fiscal year 2 worksheets and RFSs be submitted. I'm guessing that's 23.
Is the, okay, I'll guess what I think the question is, but we are just waiting for the rollover to occur so that the new rates go in, and as soon as those go in this week, then RFS requests can again start. We've been reviewing them up to this point, but then with the new rates, they will start after the rollover. But if the question is about budget worksheets or anything like that, we have waited to put those out until you can actually use them, just to help clarify that there's no confusion over which rates, which worksheets to use, but those will be up with the rollover. So you should be able to pull those off of the DSPD website.
Thanks, Kristen. And it looks like there's a concern that the WHX is not like processing, or like the WHX code needs to be fixed on the current worksheet.
And hopefully we fix that with this new one that's coming out. If anyone recognizes the issue after this, let me know, but I think we have fixed that problem.
Thanks.
Angie, this is Sherry.
Yeah.
So I actually want to address that. So Mary Jo has known about it, and as Kristen's saying too. So WHX is only for DCFS individuals. Right. And Kristen's obviously been made aware of it. Dirk, Jay, Mary Jo. So please don't bombard those people, because I actually am the gatekeeper for the state matches, and I've worked them out. And Mary Jo and Dirk and Jay know that there are some issues that have been created with the last rollover with some of those budgets. So please just let that happen. And Kristen and Mary Jo and I will kind of be the gatekeeper of that. But if there's still issues, let me know and I'll go back to the team, because we can't just keep going to multiple people, because there is a process in place. So I just wanted to bring that up. Please go the proper channels.
Okay, so, and it sounds like Kristen already also said, like, if people are seeing that WHX problem, to let her know, because we think it's fixed. So that's our hope. One more question we have is, support coordinators are being told by the RFS committee that individuals who are in school or a 10-day program are not allowed to have more than 20 hours of support outside of those services. Is this a new rule that we should expect when requesting funds? I don't know, Kristen, if you, I'm happy to like tackle that, or if you wanted to start.
Sure, either way. I can just add to anything you want to.
Okay. So I would just say that that team, the RFS team, is really looking at people's individual services. So if someone is getting feedback about like the scope of services that appear to be supported, don't necessarily apply that to everyone, right? So there are, I mean, we do have to make sure we're not duplicating school services. So that would be something that's being taken into a consideration. And then it's really just looking at like, what are the services beyond that? I know like we have people receiving more than 20 hours of services outside of just day programs, because they'll have a residential service as well, which is more than 20 hours of support across that week. So anyway, so it's really based on the individual, and it really is looking at the scope of supports in their lives. So Kristen, I don't know what else you have to add.
Nope, that's exactly what I would say. We were just looking at individual needs and what their documented health and safety needs really are. And it will vary and look different for each individual. So even though if maybe you get a response for one individual that this person cannot receive more than 20 hours, that doesn't go for every client at DSPD.
Thank you. Our next question is there a time frame regarding virtual visits ending? This is a great question. And Jessica, I know we've been having started conversations about this too, so feel free to jump in. We don't have a time frame, but we definitely have some concerns about not having enough in-person visits based on some of the incidents that we're seeing, some things that are coming to our attention. I definitely have some concerns about not having enough outside view of what's happening or going on. When you're virtual, you can't smell a person's environment. When someone can't communicate, you cannot really see necessarily, and I don't want to say can't communicate, but when you rely on alternative communication, it can be very difficult to ascertain how services are working for someone, how they're responding to staff, how they're doing in their environment. So we don't have a time frame, but it is something that we are actively looking at, and definitely see a need to address to assure the well-being of people we serve. I don't know, Jessica, do you have anything to add to that?
I think the only thing that I want to add based on the discussions that we've had is that virtual visits are currently only allowed under Appendix K. There's not language in the contract scope of work allowing for them to continue past Appendix K. So at the moment, they're only authorized to last through Appendix K. So plan for now them phasing out as soon as that phases out. So.
And Appendix K was just extended. I don't know if you saw that. So that gives us 3 months. And then we know that we have 6 months to adapt our systems transitioning from Appendix K. So just in case that helps to add to that. Our next question is there a guideline regarding billing SL3 on Saturday or Sunday? Kristen, I should have mentioned. I have a question for you.
No, that's fine. No, the guideline is that we can't bill more than 40 hours a week for SL3, or it's limited to what's been approved by the RFS committee, but there's nothing that says you can't bill on a Saturday or a Sunday for any service.
Okay. And I've had a few parents say that they are not going to send their children back to school to do past social history events, such as bullies and abuse, and fear of overall safety in school. Who is the best person to talk to about these situations to see what services can and should be provided? So I would start with the school system about what options they have available. The Utah Parent Center has advocates in every school district. They would be an excellent resource for that family and you as support coordinators to be connecting with about what services are available and how to support someone, as well as really just address the bullying and abuse. So those are places I would start. Our next question is, so how do we deal with when RFS says this is the new rules and either accept or deny, but if we deny, they close the RFS and we have to start over? I think it would be really helpful if you could either contact Kimberly Pfaff or Kristen Cornea when you run into that. Because it's hard to know kind of the scope. As you know, there are some roles like caregiver comp really cannot be more than 40 hours. And that is like, that's a factual parameter that we have. So if you could reach out to them directly, that would be helpful. Okay, so the next question is, can you please clarify what the end date is for virtual visits? You said 6 months after Appendix K, which would be what date? So I'm glad you're asking this question. I didn't give you an end date. We know that we cannot do it beyond the Appendix K, because that's what gives us the authority right now. Unless we were to change something in our waivers. But the reality is Appendix K gives us authority. It does not require us to do that. So we are having conversations about like how to best meet the health and well-being of people we serve. There really have been some really concerning things that have me concerned about virtual visits. They really cannot see everything that is happening. So while the Appendix K has been the public health emergency has been extended, so that gives us that kind of 90-day window. And then CMS has said they'll give us 6 months to transition. So that essentially gives us close to 9 months for the Appendix K authority. But because of information that we're receiving, I don't know that we will wait all of that time, because there is a need to be responsive to the needs of people we're serving and mitigate some of the concerns that are coming up. So I didn't give a solid date because we really are working to understand kind of some of those parameters. So that's why you didn't have an exact date. We don't have an exact date yet. We just had an initial conversation about this. Our next question is, do you have a date for when the massage therapy contracts will be renewed? They are not showing up in the new plans. I feel like I'm going to have to follow up with that one unless Becky is online, but I don't know if she is. So that's one I think I'm going to have to follow up on and get back to you. And it's good to know that they're not showing up. Our next question is, could we get a contact sheet for who to contact about various issues so we are not contacting the wrong person? We can get a contact sheet together. One thing that we've also done already is we have some emails that are type, right? So like our waiver manager, our NOAs, things like that we've compiled that list, which I think is a really useful place. That way, when staff change, we don't lose kind of emails that need still to be followed up on. So we'll work to make sure you all know where to find that too. So I'll have to look up where that is and get that information to you as well. Oh, look, Marcy already told you it's next to the org chart on the website. And Katie, it looks like Katie just put it in the link, so you have it.
Angie, I can respond to that SSM question
Oh, awesome.
quickly. So the contracts for SSM expired on 6/30 of 2022, and an amendment was processed to extend that contract end date to 7/31, 2022. And once those amendments are fully executed, then the approvals can be created. So it's correct that you cannot add SSM at this time, but we're hoping to get that resolved in the next week or so.
Thanks, Tyler. So Ramona, it looks like you're looking at the email and you don't know still what issues need to be directed to which staff member. Like you wouldn't know to contact Tyler about the SSM contract. We can work to make sure you know who to contact, but I would still say when there are like questions related to the waiver, or while we have a direct person, one of the reasons we've created the emails is so that we don't lose track of things that we need to be followed up on. Because that way, if a staff leaves, a new staff would have that responsibility for that email. But we can work on that. So thanks for that feedback. Susan, this should be available on Friday. Okay, it looks like with no other questions, just thank you guys so much for your time today, for bringing your questions and for participating. Like I said at the beginning, we're really hopeful that this just helps to strengthen our support for you, as well as just strengthen our system and services to people we support. So thank you for your great work and have a great day. See you.